Hello, everyone, and thank you for joining us during Nurse Wellbeing Week. My name is Raquél Pérez, and today I will be moderating the Year That Changed Nursing panel. Today I'm proud to be joined with Dr. Asa Briggs, Dr. Dewi, and Trisha Coady. I'm going to have each of the panelists introduce themselves, and we'll start with Dr. Asa.
Thank you so much, Ms. Perez, for having us. My name is Dr. Asa Briggs, and it is a pleasure to be a part of this platform again, having conversations about how we can move forward in the profession of nursing and what we can do to sort of be values added for each other. I am a program director of rural psychiatric services for Prisma Health. In addition to my responsibilities at Prisma Health, I am now a faculty member at Clemson University. So I'm excited about this conversation and look forward to interacting with my colleagues. Thank you so much for having me.
Thank you. And Dr. Dewi, go ahead.
So good afternoon. My name is Dr. Dewi, and I am a director of nursing at a major academic medical center in New York. I'm also a professor at a university in New York, and I'm also sit on a number of boards on a lot of different healthcare organizations in the New York City, both on the state level as well as the regional level. So I'm happy to be here.
Thank you so much. And last but not least, Trisha Coady.
Thanks, Raquel. I'm Trisha Coady. I have a nursing and entrepreneurial background. I was actually a flight nurse during SARS in Canada some years ago, and of course never thought I would live through another pandemic, least of all one that was worse. But I'm happy now to be working for HealthStream and have been working with HealthStream over the last 8 years, developing software and programs for the people in healthcare.
Thank you so much. And thank you to all the panelists for joining. As you all know, this year was a lot in a lot of ways for everybody, but especially for our healthcare workers. Personally working on the front lines, I can attest to, the multitude of ways that this past year has impacted my area. So the first question I wanted to ask you all is, what are the ways in which this year has impacted your specific area in nursing and in healthcare? Whoever wants to take it.
So I'll take it. I'll go with it first. So the past 18 months or over the past year has really changed the face of America. And I think it will forever change the healthcare landscape. While the general population is really learning to navigate the new normal, I think that nursing don't really see an end in sight right now. And we're so faced with the unknown. I still, as I look back, and I always talk about this over and over, that the World Health Organization designated 2020 as the International Year of the Nurse and the Midwife. And the general idea was to celebrate nurses and showcase some of their challenges as well as some of the greatness of nurses. Mm-hmm. And that was so far-sighted and visionary, because when we look back on the impact of the unprecedented virus throughout the world, it really highlighted nurses as indispensable. And it will forever be forecast the impact of COVID-19 along with all of the other pandemics that we're currently facing. In my healthcare, in my space now, I'm actually in acute care nursing. That's where it started with COVID-19. And I think when I talk about this a lot of times, I actually get teary-eyed just based on what we were faced with. Like the frontline staff, they were faced with something that we have never, ever seen before. And not only did they face with that, they also remain resilient through it all. And forever, we will see this as something that is going to impact us. Not only is it going to impact us emotionally, but it also impacting the way that nurses are coming out of nursing school, and also the way that they're practicing. We're seeing a lot of nurses now that they're trying to move away from the acute care setting, and they're going into more of the ambulatory space, which is actually going to impact the way that we care for the patients on a daily basis. And sometimes I look back and I said, is this something that should truly happen? And I also have to emotionally look at what the nurses face and look at it myself and look at what I faced, even though I was not directly at the bedside. So it's going to be something that it's going to be forever change for us. Not only now, but forever. We'll be looking at this 10 years from now and still thinking about what can we do differently? How can we change nurses differently? How can we actually have the way that even as leaders myself, how can I support my staff more? So there's so many different challenges to it.
Well, and one of the things that I've seen and heard in speaking with a number of my nursing friends who are currently working on the front line as well as leaders is that they're really struggling to try and protect themselves, supporting their patients, of course, and the families, not always able to be around them. But when they're coming home, they're also disrobing in their garages. They're wearing masks and they're staying away from their family for fear of infecting their family. And if you think about this as a prolonged period, 18 months, it's incredibly isolating, you know? And so when I think about this sort of perfect storm of all of these things coming together, we have this pandemic and the tremendous impact that's had on the mental health of our healthcare workers and communities, alongside an opioid epidemic, which sort of has this connection to mental health, alongside the health disparities that we've been really diving into. Um, that's aside from the natural disasters we all lived through. I mean, I certainly lived through a couple of those in Tennessee, especially around Christmas with the bombing. And so having to sort through all of this, and as Dr. DeVeaux said, you know, landing with resilience has been a tremendous challenge.
For sure. And I think that you make an excellent point, Trisha, when you talk about the mental health. As I described it early on in the pandemic, COVID-19 got a lot of the media attention, but the mental health piece was as important, if not more so, not only for the patients that were experiencing COVID-19 and their family members, but we're thinking about nurse and nurse well-being. I thought about, I think in my last conversation with you all, I talked about burnout and just really assuming that everyone that is providing care for individuals who have been impacted by COVID-19, that organizations need to be really thinking about strategies and structures to preserve the mental health and well-being of their workforce. Because individuals who are in the workforce, and especially in nursing now, we've seen a lot and we've experienced a lot. And let's be quite honest, a lot of our nurses before the pandemic were retiring. They were thinking about leaving the profession. And so we were already strained with resources before the pandemic. And then the pandemic happened, and we found ourselves having to do a lot more with a lot less resources. But I am so excited that nurses were able to rise to the occasion. So nurses have historically and traditionally been some of the most trusted professionals. We go the distance, and I saw that day in and day out with my nurse colleagues, both in the acute care as well as the ambulatory environment, coming to work every day. Some of them had been impacted by family members who had died from COVID-19, and they had to leave all of that in their cars and come in and be present and giving hope and giving quality and evidence-based care. And this pandemic was not happening for them in a vacuum. And so I'm just excited about the resiliency and the impact. And like Dewi mentioned, Dr. DeVeaux mentioned earlier, is that nursing has solidified a space of being a values added for the profession for years to come. And so I'm just excited to see how we can add to the body of literature, but more importantly, how nurses can take care of nurses as we move forward.
All of you bring up incredible points. And as I'm listening, each of you said something that I'm reminded was my experience too: the resiliency, the ungowning in my garage, the figuring out my mental health around working on the front lines. And currently I work in the NICU. So I have forgotten a little bit what it is like to work on a COVID unit, because that's what I was doing at the height of the pandemic. And what I'm focused on now is how to move forward and be almost like a conduit in the profession, while we're figuring out how to bounce back from this immense change that's occurred over this past year. But listening to each of you, it's a huge reminder as to, yeah, I did that. I went through a year of complete and utter transformation for the nursing profession. So the next question I have for all of you is, what do you feel has made this year unique for nursing in general? And by this past year, we're not only talking about the COVID-19 pandemic. We're talking about a whole slew of things that happened in 2020 and 2021. So specifically, what do you think has made the whole year unique for nurses? And I know that's a lot, so whoever wants to jump in first.
I think I'll take a stab at what this has meant for the nursing profession. We've been talking about social determinants of health, and I know that each of the panelists will have their own perspective about social determinants of health. But I think about access to care. I think about how essentially with an outpatient or ambulatory practice, essentially within 2 days, my organization had to pivot from 100% in-person, face-to-face encounters to telemedicine within 2 days. And so I saw that ship turn on its head with relative ease. So that lets me know that COVID-19, albeit it had a very deleterious effect on a lot of the resources and things of that nature, but it really brought to fore some of the importances of advances in healthcare. And telepsychiatric medicine was one of those advances. And so now that Pandora's box has been opened, that Pandora's box can no longer be closed. And I saw a wide swath of individuals who had, for decades, had lack of access to care. I work in a context in the rural communities. A lot of these individuals never had a psychiatric provider to live and to do life in their communities. But within a matter of days, they had access to some of the same opportunities that folks that live in more urban areas in my city had. And so one of the silver linings was that even though folks were suffering at higher rates with mental illness, subsequent to that, we had technologies and advances because of COVID-19 that actually increased our access to care. So I thought that was very, very important.
Yeah, incredibly.
I agree, and I'm very proud of the leadership that the profession has really taken in over this past year. You know, when we thought about COVID-19 at the very outset, we did not know a whole lot about COVID-19. There was a lot of information. There was a lot of changes within the profession in terms of cross-training, getting into critical care very quickly, and what we needed to do to prepare for that. The amount of critical thinking and abilities that we had to have as a profession just to be able to handle the amount of change that we went through has been really tremendous. So, you know, for me, I think about those organizations that are really investing in their nurses. You know, I certainly speak to a lot of clinical leaders across the country, and they've been very passionate about engaging their nursing staff, about ensuring that they have access to education and can develop themselves. And that's been a challenge to sort of sell internally. I think now more than ever, we need to be looking at education as being such a powerful tool, not only on contentment at work and resulting retention, but also supporting our journey to health equity. It's really going to be very key because that, you know, that it sort of all follows around in a cycle in terms of gaining access to insurance, then gaining access to care. I'm hoping that our organizations are really place much more emphasis on the individual nurse and the profession itself and investing in that, because what we can accomplish if we were just, you know, on a day-to-day basis as the pandemic may normalize, we could really move healthcare forward much more, you know, much faster and much more in an innovative fashion.
Yeah, great. And I'm going to just piggyback on Dr. Briggs as well as Trisha, some of the things that they highlighted. We had to really pivot quickly in healthcare. And nurses had to do that in the split of a second. But what COVID-19 also did was that it laid bare a lot of things, different things that were not only happening in healthcare, but also happening around us that a lot of people didn't really take an open eye to. COVID-19 unveiled during that time when everyone was at home, it unveiled structural racism and healthcare disparities. And based on that, a lot of organizations had to step into that place. They had to take a pause, and they have to realize some of the things that has been happening in this country for decades and decades and decades. even with the latest 2020-2030 Future of Nursing report, they have all 9 recommendations tailored around health equity as well as social determinants of health. But I think one of the things that we also have to take into consideration as well is that we can't really look at social determinants of health. We have to find out what's causing that. We're looking at a lot of ways to fix it, but we have to look upstream to see what's happening. And there's a speaker that I listen to all the time. Her name is Kenya Bears. And one of the things that she stated is that sometimes what we have to do is that we have to look upstream. It's like you're at a river and there's a lot of bodies coming down the river and you're taking them out. And as nurses, you're resuscitating them and you're putting them on the side. But you're not thinking about what's happening up there. Why are we having 100 bodies coming down? So COVID-19 not only unleashed what was the pandemic itself, and it caused us to realize some of the things that we need to take a closer eye and look at and try to fix those issues. For the staff themselves, apart from the structural racism that I'm talking about, I think self-care is not self-indulgence. Mm. As nurses, we need to pause and we need to take care of self. And one of the things that I do as a leader is that I take care of my team so that they can take care of the patients. So we have to get into a place and a mindset that we're looking at the emotional turmoil that COVID-19 caused on our staff. So we label our frontline healthcare as heroes. And some of them, they don't even want the title as heroes, because the title as heroes is saying that you're superhuman and you can save everyone. And that was absolutely not the case. And then also when you look in the media, and I don't want to go off topic, nurses that were at the bedside, because I was there 7 days a week. Mm. For 4 weeks, I did not see my kids because I would make sure that I was there for my staff. Mm. And you have nurses there day in, day out, but they were not showcased in the media. They were not showcased as intelligent, educated people that is there taking care of the patients. They were showcased as the victim that have the scars on the face. We see that. And people empathize with nurses. But nurses were the one that were caring for these patients. So I would like to see that change, and I want to see it change forever. That nurses have to have a place in society that people see that we are there. We know science, we've done the research, we're educated, and we are able to provide that education as well. So I want to see nurses showcased in that formula.
I absolutely agree. And I know as I think about the healthcare workforce on the whole, what drove us to getting into nursing was that passion to serve. And I think a lot of things, because of that, I'm more likely to go above and beyond what my mind and body may be able to handle. So the risk of that too is that burnout can appear very quickly. And so we also have to have a system that takes care of its nurses when that happens.
And I think, to Dewey's point, and I love that metaphor, I often use that upstream analogy. And I think one of the things that we need to kind of investigate and do in autopsy post-COVID and maybe even during COVID is how nurses are perceived in the healthcare team. Mm. And what I mean by that, I think that just overall, we don't engender a culture that really values the voice of nurses a lot of times. And as we mentioned, we are nurse scientists, we are nurse educators, and we provide the critical level of care that is essential for patient survival. And I think now, because of the way that the healthcare system has been upended, nurses now have an opportunity to be the change agents that we know we are, to really burden and not only carry some of the weight, but really sort of be given credit for some of the weight and some of the responsibilities that we have done historically to make sure that the healthcare system works. And so those inequities and those social determinants of health are not just relegated to the patient population that we serve, but it's actually present in real ways within the healthcare system that I think post-COVID needs to change as well. So, because I saw my colleagues, just as my physician colleagues, my PA colleagues, my MAs, etc., we were all thinking on the fly and coming up with ways in which we could better care for our patients. It wasn't just at the provider level. It was throughout the entire healthcare system. And so when we think about interdisciplinary approach to medicine, we have to think about folks that don't always sit at the tables and make decisions based on their credentials. But it was folks that were thinking about, how do we reuse N95s? How do we use PPE multiple times? These were folks that weren't just the providers. These were folks that had been working and working in isolation, environments way before COVID-19, and they were some of the thought leaders. And so I think that we need to center some of the voices of the folks that have historically not have had voices, and that is some of our ancillary staff. So if you guys are watching this, kudos to you as well, because a lot of the stuff that we were able to do was because of your willingness to be a part of the healthcare team.
Absolutely. Emphasis 1000%. I mean, I agree with that wholeheartedly and relate to everything all of you are saying. And we know that the pandemic is continuing. It hasn't ended. It's still, there's still many nurses and healthcare providers all over that are dealing with the results of even bigger wave at this point. Some people are calling it. So my question is, this is a panel about the year that changed nursing, because the pandemic changed the direction of healthcare, but how do we gain control of that narrative as healthcare workers, as nurses, and see the opportunities that there are to change the profession, whether it's systemically or improving it, or even just supporting our nurses more? What opportunities can we take from the pandemic so that we can kind of change that narrative?
I think one key thing that we should be thinking about in terms of investment is that, when a public health emergency occurs that disrupts nearly all aspects of the healthcare delivery systems, the prioritization of needs is really critical. And I think about, the closer you get to the patient or the resident, the higher risk reward. And so the opportunity I see, as we've lived through a lot of risk, is there's tremendous reward in learning what happened throughout this process. Similar to what Dr. Briggs had talked about, we learned, how to do infection control in a much more unique way, and a more cost efficient and a more efficient way for all of our clinicians, all of our care team. And so that risk or reward growing closer as you get to the patient, I think there's a lot of benefit, even from the telehealth pieces of the different technologies that we've now come out with, thinking about being in this constant state of readiness and prioritizing that, I think will be incredibly helpful, not only for our frontline staff, but also for our communities.
Absolutely. Dr. Asa or Dr. Dewi-DeVeaux?
Okay, go ahead. So, COVID-19 really upended so many different layers. It really, truly did. And it's a lot of times you have people that say, if you don't take a walk in my shoe, you don't understand what I'm going through, right? So not only did COVID-19 impact the entire healthcare system, it's that being in an organization or even seeing the reports day in, day out, and you realize that it's only a certain population that has been affected so significantly by this virus, have you start thinking on a different level. And I know that throughout this conversation, I keep on talking about the different racial and ethnic disparities, and maybe it's because my entire doctorate study was dedicated to it. So it happened right before, and then this happened. I was like, oh my gosh, maybe I'm like the World Health Organization, seeing things before it happens. Seeing that there's certain population, I think there has to be not only policies that are in place. We can't just make statements. There's a lot of statement that's out there about COVID-19, about healthcare disparities. We have to make sure that we're putting things in action. So we have to take care of the nurses, but we also have to educate them from the beginning how to actually take care of the patients that they serve.
Mm-hmm.
And we have to make sure that these things are folded into the academic platform as well. And we have to ensure that we have the tools in order to do it. And I believe that organizations, not only should they make statements, they should treat it as one, just like how CMS, you treat other quality indicators. Disparities need to be treated as a quality indicator. It has to be measured. So we have to be able to put a plan in place. We have to make sure that we're measuring that plan that we put in place, because COVID-19 has unfolded that, and we cannot stay blind to it. And we cannot turn our eye away from it. We have to make sure that we fix it, and we can't stop talking about it. And then for the nurses overall, we have to take care of our nurses. And I can't really say that enough. And nurses have to also create their own light at the end of the tunnel. They have to be able to say, I have to pause and I have to take a break. And healthcare leaders, and I'm speaking because I am one, they have to be able to look at a staff on the floor and say, pause and take a break. I will cover you. And I tell my staff, I don't know what to do. I have not been at the bedside in 14 years, but I will go in there and I will cover you. We have to be able to see our nurses as human beings and not our nurses as someone that is just delivering care after care, regardless of what's happening. And that's how we can preserve them, that they actually stay at the bedside and provide care. So there's multiple to this. There's so many things that we can do, but those are the two things that I'm going to highlight.
Yeah. I think that you make a really good point, and something I was thinking about is how do we pathologize racism and inequities in our curriculum, in our institutions. And so really looking at ways in which we, unbeknownst to us, just simply because of implicit biases and things of that nature, that we're continuing the legacy of racism and how care is being delivered by how we pathologize and give seats at the table to some of these things at institutional levels. And so I think a part of that regaining the narrative is talking about things like that at academic levels. And so some of our hospital settings are academic institutions as well. And so what better way to kind of look at quality measures and to look at the way we're educating our students and how are we pathologizing racism and institutional inequities within our educational structures. And so I'm hopeful that now that I'm sitting on this side of the table, that I can begin to lend voice to some of those things. My organization and, both my academic institution as well as the hospital that I work for, they've come up with a research for health disparities. So I sit on that council. I just had a conversation prior to coming on this video to talk about health inequities and what sort of ways in which COVID-19 has brought these things to the fore and have highlighted these inequities in care. And what does that mean for us now that we know that there's an elephant in the room and has been there? It has names and labels now. So how do we move that forward? I think nurses are also unique in that we always think about the patient from a biopsychosocial model of care. So this is within our bailiwick and our wheelhouse and has been not just within the COVID-19 crisis, but to really look at the patient holistically. And so some of those things that we've talked about, from social determinants of health, access to food insecurities, housing, all of those things are now looking us in the face and giving us an opportunity, again, to be the nurse researchers that we are, to implement and then look at the implementation and what we can do to better improve and to build upon the research that we already know is there. So I think that nurses are sitting at really good positions now because of the work that we've done historically, but especially in light of the COVID-19 pandemic that cannot be ignored or undermined any longer. And so I think that's how we change the narrative, is that we start pointing out key indicators, key performance measures, KPIs, and looking at who was at the table, who were making those decisions. Oh, nursing was here. And not only was nursing, there wasn't a dearth of resources for nursing. Nurses provided robust opportunities for us and literature and research. And they were here, and they are a values added to our team. And so I think that that's how we really take this by the horns and we really move this thing forward, is because the healthcare system now has to say nurses are a valued team member, and what do we do to leverage that?
I love that. I totally agree. Nurses are here. We have always been here. But the spotlight was on us for a long time, and I think will continue to be and should continue to be so that we can change healthcare in positive ways, in the ways that it should be changed. But Dr. Asa, Dr. Dewi, and Trisha, I thank you so much for being on this panel. Appreciate everything you're doing in your professions, what you're doing to support nurses. Before we close, I wanted to ask each of you just some final thoughts that we can give our listeners, our viewers, some either positive thoughts about the pandemic or some words of encouragement or ways that you hope that we can change the profession. But I'll go backwards this time. We'll start with Trisha and then Dr. Dewi and Dr. Asa. Just some final thoughts.
Sure. So first, thank you for your incredible courage over these past 18 months, and quite frankly, every day. While I believe that many things will change as a result of COVID-19, one thing that will remain the same, and that is nurses have been and will always be at the bedside 24/7 providing care. To be in a constant state of readiness and ensure nurses are equally competent, healthcare leaders will really need to leverage technologies and help individualize and recognize that nurses are such a meaningful part of the care team as our whole care team is, and spend the time on to invest thoughtfully into growing our nurses and continuing to engage them.
Thank you.
Thank you. And I'm going to echo that, Trisha. For the nurses that's out there, I really want to give you my absolute thanks for everything that you have done so far during this pandemic. The work that you've done is unvaluable. It's not about being heroes, but it's about caring for that patient every day, day in, day out, as if it's your mother, your father, your neighbor, your loved one. Those things are things that a lot of people really don't see. I'm also hopeful that the nursing profession will no longer be suppressed in healthcare in some way, and that you will continue to rise to the occasion, because I'm proud every single day to say I'm a nurse. I am proud to echo it at the top of the mountain, and I'm proud to echo it every single day that I walk into class and I talk to these students. And I say, this is the best profession you'll ever find in your career. So continue to do the great work. And we're always here to support you 110%.
And I will close by saying you rock. And I want you to know that your values added is not just what you bring to the healthcare team, but who you are as individuals. And the importance of taking care of yourself, absent your profession, is going to be so important. So dream bigger than just your ability to provide care. But what does it mean for you to have wholeness and agency outside of your profession of nursing? Because we know that just by nature and who we are, we want to give ourselves 100% to our profession. That's what really sort of draws people in, is that we really care for people. But one of the most important persons to take care of and to think about is yourself. And then the next point I'll make is opportunities of a lifetime must be seized within the lifetime of that opportunity. That was something that a mentor of mine gave me as I was entering into the profession of nursing. Seize the day. We have the opportunity to be change agents. We have the opportunities to really sit at some of the high-level seats that oftentimes have evaded us. And so I want us to take this opportunity to move forward and to move this profession forward in ways that we know that we can. And now that the healthcare system that we're in will begin to recognize. And so thank you again for your work and for your commitment. And we do thank you for all that you do. And I'm excited about being a nurse and proud to call you guys my colleagues.
I echo everything all of you have said. And I want to just reiterate, I've said it before on the Keener app, we are people first. And so taking care of ourselves first is incredibly important to take care of others. Panelists, thank you so much for joining. It's been a pleasure, and let's keep changing the face of nursing.